Hello, good morning, everyone. Welcome to the IMC talks. Today, I think we're just waiting for a few more people to come in this morning. So we might just wait a minute, just get them to join. Lovely. Well, thanks so much for joining us. And today we are going to be talking all things men's health with Dr. Chris Eldridge. If you have any questions, feel free to leave them in the comments section or the chat, and I will we'll try our best to answer those at the end of the talk. And if everyone can just be reminded to mute their microphones, that would be great. So I will hand over to you, Dr. Chris. How are you this morning?
Very well, very well. Just sorting out my side.
Sure.
Yeah, there we go.
No problems.
Yeah. So, everyone ready? That's better. Good. There we are. Good. Lovely. So, okay. Thanks, Alice, for that. So if I get going, I mean, a lot of this stuff is, there's no fixed way of really explaining health screening, and I think every country does it differently. Every clinic does it differently. You know, there's no wrong or right thing to do. You know, but the crux of this, I think, is it's more a prevention now than screening, I would say. It's not just really trying to pick up people that have medical symptoms or illnesses. It's more trying to prevent everyone of realizing what leads to all these diseases in the first place. So most of the European, Australian, and American guidelines are more trying to create a universal program for everyone to prevent instead of screening, and give people a sort of a risk assessment, you know, based on where they are, their family history, and help people stay well for longer. So it's really appreciating what the important things are that you may not do, especially when we live in Singapore, which may not be our own country, that, you know, we don't get governments writing to us and telling us what we should be doing and when. And because every country does it slightly differently, some people start at 40, UK starts at 50, America does one, as I say, at 40, Australia's at 45. There's totally different ways of doing things. So I think it's nice to have a chat about the important things, the baseline things that everyone should be doing really, and how to interpret them. But, you know, simple questions, you know, so the NHS, for example, would start, everyone would have a simple questionnaire, simple blood tests, you know, the risk of heart disease, stroke, diabetes, kidney disease, and really work out individually their risk and how to reduce risk and prevent diseases. They do that every 5 years from the age of 45. They're trying to roll it out from the age of 18 now. So it is, you know, pharmacies can do it, nurses can do it, community facilities do it, not just doctors. So it is rolling out more now around the world as prevention to save money as well, I suppose, rather than picking up diseases per se. So you shouldn't see it as, see if I've got any diseases. You should see it as, how can I prevent something from happening? But as I say, every clinic, I mean, a lot of you probably have had medicals before and gone to different places, and they do subtly different things in each one. Some not needed, some needed. So it's difficult, I think, for the average patient to know or trust who to see, what to sign up for. And as a GP, it's quite difficult from our side, I think, that to do a robotic blanket approach for everyone, and I think that's wrong. We've got to really individually tailor it, as long as there's some baseline. So, you know, when you see on the IMC website, oh, we can do this or we can do that, when I actually get patients in, as all the doctors do here, we do individually tailor it based on evidence-based medicine. So it's not what you think, like if you go to another company, they'll just do a robotic baseline no matter what you tell them. I don't know how that works, because you need to really see and adapt per patient. So that's what we do. And I think that's actually the most important part of health prevention and screening, is really adapting it to the individual. And I think that's what we do, I think, better. And that's why I think it's important to come in and have a chat. There's no fixed approach. that's the end of the day. And every culture and every doctor is different, but as long as you get the baselines correct, which I'm going to go through now, the rest of it should be straightforward. So, you know, it is difficult, I think, to really talk without people feeding back to me quickly. But I think it's important just to go through, and at the end, you can ask me any questions you like, and we'll take it from there. So, briefly speaking, you know, the topics we covered, like lifestyle tips, cardiovascular, risk factors, prevention. We'll talk through all of these. The sports stuff and the mental health, you know, that comes through as well, I think, in screening and prevention, because when we talk here, most patients have other things going on. They don't just come from a medical. There's a few things that they build up, because we're all busy. Most people are extremely busy here. It's really tough at the moment, and a lot of people haven't got time to go to the doctors, and often they like say come in with a shopping list, which is great, by the way. Everyone should come in with a shopping list, and we give them time to go through sports injuries and other little niggling things. So the screening and prevention program we're doing isn't just that, it's also a GP consult as well. We're putting all this together, and it is flexible, because after we've done the bloods and things, we then communicate by email or phone. It's a flexible, fluid sort of arrangement after that we go, and all the cards are put on the table about what we can do. We don't have to make any decisions. And then we do communicate over the weeks and do different things according to what the results show. So it's not always just a one-step process. It's usually 4 or 5 until we get it right. So these headings are basic headings. So that's what that slide shows. I mean, this really is just, again, just showing you that there's so many different variables to health and for prevention screening. And what we talk about is not just computer printouts. I mean, it's all of this stuff here is important. You know, going back to the office, and, you know, the physical exercise in Singapore, the environmental effects of Singapore are enormous, the aircon, the heat, you know, no one sleeps well here, the toughness and not traveling. There's so many aspects to our health. Alcohol, diet, sleep is all important, but we're not robots either. So we basically just trying to tell you what the basic important things are. And so along, you've got some appreciation of what the important things are. It's not just doing blood tests, going to your doctor and saying, "Oh, just screen me and I'll get on with it." It's all about prevention from all these factors. But don't be overwhelmed as well, I don't think. I mean, it's, you know, just a few important things can make a big difference. So there's a standard charter run going on in 2 weeks' time that we're all doing, and little things, little goals. You do a bit more exercise, and it really shows how quickly you can change your habits. The eating, I'm not going to talk too much about that. I mean, there's some basic, you know, calories. Some dietitians would say don't talk about calories, talk about eating healthily, eat your regular meals. I mean, a lot of people, of course, are doing starving, and you know, they basically do plant-based diets, and everyone's doing something at the moment that is not too medical. As long as you're getting what your body needs and you have a healthy, common sense diet, I think that you have your 3 portions a day. It's just being consistent. Some people have, you know, they come in and say, "I've lost all this weight and I'm feeling great because I'm eating plants and I'm doing that." All great, but it's this sustainability. You've got to be honest to yourself and really think, right, what can I do that I can sustain? And when we got families as well and children, and making 2 or 3 different meals is just, you know, really tough. So you've got to be realistic. But food and exercise are so important. You know, as we get older, we're not 21 and we kind of think about it a bit more, but it's all about prevention at an earlier age than screening. As I say, that's really important take-home message, I think, for most of this is prevention. Don't think of it as just screening. That's why you've got to do it often, because you just never know. You know, a common question as well that people ask me is, how much is exercise? What are the medical professional advice? So this is from the British government website, and the CDC in America does kind of the same thing. So I think it's quite nice. You know, it just shows you really what we generally would like to do. So 150 minutes of moderate exercise per week, which means brisk walking, cycling, swimming. So what's that, 2.5 hours a week? You know, that's not too much, but it's still, you still got to make time to do it in your busy life, going back home to the family, kids, and exercise. it's not easy, but there's no reason not to do it. Vigorous exercise there, 75 minutes. So, an hour and a quarter. Some people run, a 10K run once a week, but I don't think that's enough. It's really 3 times a week doing a regular thing, and it's good for mental health, of course. That's really important. Building the strength, minimize sedentary time. We're all sitting down. It's not easy. So it's really just basics there. Some people like figures. Some people don't like figures. Some people just need to be active and do half an hour every day. But I would say if you want it in figures, it's the 2.5 hours a week. It's not too much, but it's important to do it. And all those figures at the top: improve sleep, quality of life, decreases diabetes. I mean, it is true. So all these things are important, but those are the black and white figures if you want to know what the evidence-based medicine is saying to us. So 150 minutes a week. The other things I put on the left there, risk management is what it's all about. So when people come in, the first thing we really ask them to do is fill in their family history, what they've had done before. Most people have had health screenings in the past, getting previous. It's always great to come in with your previous blood tests from different countries. That's one of the things I like working here, is you see screenings done in different countries, and the way they approach is completely different in every country. It's amazing, really, but we're all human beings. So some countries would over medicalize, some people would under medicalize, something that makes no sense whatsoever. So we put it all together and try and reconstruct it. So, but the Q risk there, just so you know what that is, some people may have Googled that already. That's it's a holistic, you put that in a website with your age, smoking, diabetes, family history, your cholesterol results, your weight, your BMI, and the Q risk is based on hundreds of thousands of data of heart disease in Northern Europe. How many of them went on to have heart attacks and strokes or events with the stats that you have? And we can give you a risk based on your stats. How many people with your stats went on to have these diseases? So we use Q risk quite a lot, and it's very interesting. But it's all taken with a bit of common sense as well. It's just not black and white. We adapt it with the patient, and that's very important, because if it doesn't come from the patient in the end, you're not going to comply with what we suggest. So we start the ball rolling. The body mass index and all these figures that we'll do when you get triaged, when you come in, and I'm sure all the medicals do. I don't look at the body mass index too much, personally speaking. As long as you're active, you're can be 65 and you're labeled as obese, which is ridiculous, of course. So we use that with a pinch of salt. It's more, if that's the only thing sticking out, then we can adapt that. But BMI is just to have an ideal and give people, but it's all about fat content that's a bit better and have an appreciation of it. But we don't look at that too much. But there are all these things on the left there with heart disease, lung disease, most of it's common sense stuff. You're at risk of diabetes. So what we don't want is people coming in, to be honest, mid-50s, overweight. They haven't not looked over themselves. They haven't prevented, and we've got to change them. Their blood pressure is already high. Their cholesterol's high. They haven't done any prevention. That's the tough customer, where we're not going to change it that much, but we're trying to catch people before that, when you're in your 30s, early 40s, and still have time, your body can adapt and change your lifestyle. That's the most important thing. So that's what that says. Cardiovascular disease is what is really the most important thing. So as you can see there, I know these are England stats, but all around the world, number one that most people worry about here, especially amongst the men, is their heart. When they're running, have they got heart disease? Can they push themselves? Am I doing any damage? What are we doing here? A third of all deaths are basically heart related. That's the bottom line. So there's tests that we can do. I'm going to talk about that, what the options are to prevent your heart disease, what screening we can do for that, what tests we can do. Some really fascinating stuff. It's great here. Singapore's amazing that we can do whatever we want here. So there's so many options here. It's one of the best countries I've been to use the medical health. And if you use it wisely, I think it's amazing. So that, and I'll talk about cardiovascular disease, so the risk, as I say, so the basic stuff is we'll ask all these questions, how active you are, your family history, drinking, diabetes, obesity, high cholesterol, all these things, your risk, individual risk, we're putting that into risk calculators. And I'll tell you my experience, as we all will here, what really that means. And you get a feel of someone. I think the important thing of medicine is, as a GP, that's different from screening centres. There's millions out there, Raffles, Fullerton, Parkway, the difference I think we have is I need to feel a patient and see where they are. And that gives me so much information of how to adapt what I say to them. So it's never the same conversation, even though I'm got the same test. The way I communicate that is completely different. I think that's really important, because otherwise people won't comply with our advice. If it's just a computer printout, do this, do that, most people won't do it. So I think when we do talk, it makes a big difference. Heart disease, diabetes are the most important thing I think that most people worry about, because you don't know, because heart disease would be asymptomatic. I mean, diabetes as well on here. I mean, I know it says symptoms: excessive thirst, urination, fatigue, tiredness, but realistically, what do I see? No symptoms. The blood test that we do, HbA1c, fasting glucose are off, and some of the fittest people I see have got diabetes, and we don't know. There's genetics, family history. We don't understand it that often, so people rarely present with excessive thirst or urination. Actually, it's just the blood test to pick it up, because by the time it's called thirst and increased urination, it's already there and already a factor and probably causing organ issues already. So what we want to do is prevent this, as I keep saying, but it's true. So over 40s, being obese, yes, you're more at risk, but it's not as easy as that. You just don't know without doing the test. So if you do the test and you're great, it gives you a 3-month average of your sugar. This is the HbA1c that I'll talk about later. Yeah, I think it's all great, really, and you just don't know. So we don't want people to come in with already symptoms. That's what we do as a GP world, but we're trying to prevent all of this. I hope that makes sense. So this really is, overall, what are the best ways of informing you guys of the best things to do, the way we can prevent, the tests that give us the most data, put all that together and see where that takes us, and then basically communicate afterwards about where you are. So so straightforward, really. So when people come in, so I'm going to take you through some of the options here. There's a blood test block, there's a heart block, and there's a cancer communication. These are the 3 main communications, I think. That's how I word it anyway. It's blood test, heart, cancer. And within those 3 blocks, we kind of adapt to people, and we can do whatever we like, what the options are, and we move through. Prostate and testicular cancer, men, of course, are the main 2. Skin cancer is the next one as well. And bowel cancer. So they're the 4 ones that we talk about most. As you can see here, prostate is very common after 50. Family history can play a part. It's not easy. I mean, they'll take you through some, you'll see in the screen, and we can reflect on it later, questionnaires about prostate symptoms. How do I know if I've got prostate cancer? It's a difficult question to answer. The most people that I see here that are diagnosed with prostate cancer, they would have no symptoms. It's actually the blood test, the PSA blood test I'll talk about later, it raises through the years. So it's so important to get baselines, and then you can compare and contrast over the years. That's invaluable. That's how we pick it up. As scary as that is, it's not people coming in for urine symptoms. It's just we pick it up. They're not aware. So it's very important to have that discussion, I would say, from the age of 40. England don't do anything. Australia does one at 45. America start at 40. I would say start at 40 for sure. Testicular cancer is early, starts in the late 20s and early 30s. It's really on the average age is 33 for testicular cancer. But again, it's a painless cancer, testicular cancer. So unless someone shows you what you're looking for, you're not going to know, because they're painless lumps that you can't distinguish between your testes and the rest. But it's so easy to diagnose with ultrasound that there's no reason not to get them checked. You know, so those are the important things. What are the symptoms? Prostate and testicular usually present or get picked up with patients having no symptoms at all. So that's really important to know. Once symptoms are there, it usually means we've already gone and we've missed an opportunity. Prostate testing is a grey area. It's less grey now. I think it's one of the most difficult things because it's not licensed as a screening cancer marker yet, because it's not accurate enough. Prostate specific antigen is what we test for. You know, it can be raised by too much exercise, urine infections, prostate stimulation, medication. So it's not as specific as you think, but it gives you a baseline. But we know if it's above 3, we should repeat that. We get an MRI. If it's somewhere in the middle, we just monitor it over the years. So it is non-specific, but it's so important to do because there isn't anything else. But unfortunately, you know, people that have normal PSA values, 1 in 7 will still have prostate cancer, even though their PSA is normal. But there's nothing we can do about that, really. We don't just MRI everyone. It's a bit, not very cost effective, but it will pick out the important ones, or people there at the moment. In the severe ones, they'll get picked up. But the ones that are localized to the prostate gland, there's no symptoms. The PSA can be negative, but it's the best we've got. But as I say, the scary thing is everyone that I've seen since I've been in this country have been picked up, there's no symptoms at all. So it is very important to have that discussion as well. There are other tumor markers that other companies use, but it doesn't make any sense. PSA is the only one, really. That's what I would say. So that's a brief bit about prostate cancer. This is so when people come in, I give people this. If you want to know what the symptoms are, which is important, when should I be concerned? What this means is International Prostate Scoring System. So you do this with the PSA, and you get a prostate health index. And that's what we use to screen people, or prevent, I should say. As you can see there, in the last month, so it's like acute changes, not since you were a kid. It's like in the last month, do you feel you can't empty your bladder? Are you going more often? Not because you're having 20 coffees a day or starting your gin and tonics early. You know, are you dribbling? Do you have to run urgently? You're getting up in the middle of the night a few times when you didn't before. You know, this is what we do there, and we give you a score, as you can see in the bottom middle there: mild, moderate, severe. If it's severe, we do a PSA. That's what we would do in a public system. If you're severe, we do a PSA. We go forwards. If it's high, then we get the ball rolling. But you know, so it gives you a little idea. Most people I see when I actually do this, they come in, they get a score of 8 to 10, and they don't really need a blood test, but we do it anyway. It's just to show you here what we ask and what we look for. These are prostate symptoms rather than bladder symptoms. So that's a good one. So, I mean, this isn't part of really screening for now, but a lot of people do ask about erectile dysfunction, you know, in many ways. It's not really a disease, erectile dysfunction. It's just a symptom. That's the important part about that. And I would say that the important part is, of course, is we really ask if there's anything behind this. You know, we check your cholesterol, we make sure you're not overweight, we check your blood pressure. 99% of the time it is just psychological, but we make sure there's nothing else going on there. And then we move forwards when there isn't. And 99% of the time, there's no reason. 52% of men over 40 have erectile dysfunction. What that really means is they're not happy with the quality of their performance, or their partner's not satisfied, which is really stressful and important in a relationship. I don't need to tell everyone that. But we do screen people just to make sure they're not on medication. Like antidepressants can lower your libido, can flatten it completely. That's important to know. Blood pressure medication can flatten it completely. Cholesterol, diabetes, but it's also, as I say, it's normal in 50% over the age of 40. So it's a very common thing. And there's so when your blood flow is limited and over time, again, that's too medical. It's not really, it's more the stress or emotional things. But we do look at the early warning signs from their point of view. So we never just give out tablets. We make sure it's all fine. But then the door's open. I mean, in England, you can buy these over the counter from any pharmacy. So we don't even, the pharmacists don't even ask any questions. You just sign a self-consent form, and Cialis and Viagra are ready to everyone. So that's a very common topic. Not much about health, but it's just an aspect that we can talk about from that perspective. But it's not a disease, it's a symptom. So, I hope this is not information overload. So basically, when you come in, this is really what we do, okay? This is what I was saying, the blood test block, the heart block, the cancer block, okay? Vaccines a little bit on the side, very important. Not as important as well, because we're starting traveling again, but not as it used to be. People are arriving, traveling constantly. We had a good vaccine talk, but we still, my opinion is the bottom line of what vaccines are really important for living in Asia anyway. So look, so that's the heart, the blood test. There's a standard stuff, cholesterol, liver, kidney, thyroid, vitamins, vitamin D. All this stuff is important, but I do ask everyone, is there anything extra you want me to put on there? Some people want STD checks, HIV checks. It's always flexible. But I know what the important stuff is. So that's what we do on that note. And we get the answer the next, more or less the day or day after. And the way I practice anyway is that gives me a lot of information. And then that's black and white stuff. And then we know where to go from there. Heart is a bit more interesting. And if I talk about the heart, what I would say about that is there's a couple of ways of doing it. Heart options are there. So the way I talk is you either do NHS style, right? Government style, like nothing. So exercise, don't drink, don't smoke, within reason. Be active, eat healthily. We check your cholesterol, measure your blood pressure. That's it. And if you ever get chest pain, go into a doctor. That's one way of doing it. But of course, the other ways of doing it are the bottom to cardiac treadmill, CT calcium score. So this is what I mean about it's great here. These tests are amazing. I mean, I think they're amazing. So everyone should do this stuff. The cardiac treadmill test is an ECG when you're running for 20 minutes. Yeah, we don't do the mind. So we refer to Gleneagles, Harley's. Well, I do. Probably shouldn't say that, but they use their facilities and their technicians to do the test for us, and the cardiologists tell us what to tell you guys. I think it's an amazing test. So my opinion is from 40, everyone should do these every 5 years, the cardiac treadmill test. It's a fitness test, your blood pressure, your pulse, how fit you are, underlying screening for heart disease, 70% accurate if you've got an underlying heart disease. Some people would say it leads to an over-treatment. Some people would say if you've got a fit 25-year-old man, why are we doing a treadmill test? Because then it could get a false positive, lead to a CT calcium scan. We're over-medicalizing people. But done in the right hands, it is fine because there's no invasiveness and no misinterpretation. So I think they're all amazing. It really estimates your risk of heart disease, the treadmill test. And I think the most important part of that as well is different ways, like it rules out heart disease. So a lot of people come in here, especially men, they're feeling something. Is it my heart? Is it stress? Is it my neck? Is it my posture sitting at my desk all day? Is it my heart, doctor? So we do test for here, not just because we're worried. I think that's amazing. So I send people to have the running test. If they pass, they know pretty much it's not their heart, and it gives them a good sense of confidence and it makes them more fit. So I think it's a very important test to do. The third one, CT calcium scan, is another great one. There's no needles involved. It's like an angiogram without the dye, really. From the age of 45, I would say, it looks for calcification in the heart, and tells you if you've got any blockage, yes or no. You know, and if it's 0, you kind of get a 5-year heart clearance. If it's a little bit here, you get a 3-year heart clearance. This is not in textbooks, but that's how we practice, and that's what the cardiologists say. So CT calcium, when someone comes into me, Scottish, Indian, about backgrounds, because they're more likely to have heart disease, evidence-based medicine. So I'll always ask people their background. And their mum, dad, uncle at 45 had stents put in, heart disease, you've got to have a CT calcium score, no brainer. If someone's got not as much risk factors as that, we start with the treadmill test. But look, a lot of people come in and say, look, I want everything. And fine, I give them everything. So, because as long as it's interpreted correctly, it's a great stuff. The standalone ECG that I've written on the top there for cardiac testing, I'm not a big, you know, we can do that, but it's not as good as a treadmill test, because the standalone resting ECG that a lot of clinics do here, I don't get that. I mean, it shows you if you've had previous heart disease and ongoing arrhythmias. It doesn't show you what else is going on. It doesn't prevent anything. So I don't really offer that, personally speaking. I give people the bottom 2 options only. But that's because that's what works. But that's the heart block. Great stuff. I love that one. Cancer stuff in men is pretty straightforward. Men are always easier than women, and so it's a pretty straightforward. But the important things really is trying to pick up things before it becomes cancer. And the only thing that's really licensed for that is bowel cancer, you know, testicular, prostate, mole check. That's the important stuff. You know, in the intestinal screening from the age of 40, 100%. I've seen bowel cancer being picked up here 42, 43, whereas in England it starts at 50. Again, America starts at 40, Australia starts at 45, but 40, it should be 40. Stool sample, you know, we do one stool sample. It's an immunochemical sample. You know, that's more than good every other year into your 65 or 75. I mean, Wales and Scotland do it till 75. England does it now from 50 to 59, which is a bit strange. I think everyone should do it from 40 to 75. Every other year, stool sample. If it's negative, that's all you need to do. If it's positive, have a colonoscopy. Some people, in my experience, especially the American and German contingency, are used to having colonoscopies from the age of 40. And what that does, it gives them a 10-year clearance of bowel cancer. So they don't do stool samples every other year. They do colonoscopy 40, 50, 60 done, unless symptoms change. But that's the theory. So again, great colorectal units here, very efficient services. So I give patients options. Do you want to do stool samples every other year? Do you want to have a colonoscopy? No wrong or right answer, but do something, right? Because you're not going to get a letter here from the government saying you're due your bowel cancer. That's the problem here, that if you work around the world, not just Singapore, around the world, and it's not your own country, you're not going to get screening or prevention unless you go and do it yourself. That's a big problem here. So prostate test, PSA, testicular examination, mole checks, very important. And you know, I'm not just saying this. I mean, I'm just being honest. I mean, the last 3 melanomas I saw, I say this probably to everyone, I would never have known. I mean, I actually look at the moles, but honestly, I also refer to a skin clinic to do the mole mapping machine, to do the dermatoscopes, you know, you got to take advantage of the system here. I mean, why not? I mean, whilst you're here, you've got to use these amazing people out there, dermatologists, consultant dermatologists, amazing specialists that, as I say, my eyes would have not picked up these 3 melanomas, as scary as that sounds. I would never have noticed, but I referred them, and there was grade 0 melanomas cut out and prevented. It's all about the prevention, as I say. Scary as that sounds, most of us are not designed to be here, and the white skin, once every 3 years, you have to have a mole map. It is what it is. You've got a family history of melanoma from Australia, it should be yearly. Doesn't matter where you're from, you've got to get it 1 every 3 years. Very important, I would say. And a lot of clinics don't do the moles and the skin check as part of their screening, which that's a big thing here. Even in this weather now, when it's raining, it's still UV light, you can still get burnt. I would be burnt if I don't put sun cream on, wear a hat when I'm running. You've got it, it's very important. But that's the important stuff. Hope that makes sense. Vaccines, everyone should have tetanus every 10 years. They should have Hep A and B. Hep A is from traveling water. Hep B, there's just you're more at risk here. You know, it is blood, and tattoos and unprotected intercourse, but it's also falling off your bike in different countries or surfboard wounds, and then approaching the medical health system. So it's better to be protected for Hep A and B and tetanus every 10 years rather than having them in the emergency department or A&E. That's what I would say. So we can check the status on the blood test, whether you're immune or not. So quite nice, I think. So I think from a health prevention, that's what we do. Is your background risk. We ask you to fill in things. I see what your risk is. We do the bloods, we do the heart, we do the cancer, we do the vaccine. We have a discussion. Anything else that people are worried about, we of course approach it as well. We then put all that together and we see where you are. And if there's anything off, well, then we approach it. If it's all good, then after that, it's interesting. How often do you do them? Which is a common question. No answer. No, I mean, I wherever I've trained or worked in the world, you kind of get things stick with you. And like my approach is, you can do it every year if you like. You can do it every 6 months. You can do it every other year until you're 50, and every year when you're over 50. There's no wrong or right answer there. Most people that I see in Singapore are educated, successful. Their company covers it, the insurance covers it. So you do it every year. I mean, we don't have to do the running test and the CT calcium scanning every year, but the bloods and the discussion, I think it's important just to make sure things don't change. So that's really what the health screenings are around. Now, some companies will do ultrasound of abdomen, they do chest x-rays, they offer ultrasounds of prostate, what else do they offer that I've seen? It makes no medical sense. I mean, for me, that just means they're looking for things to do other things. And don't get me wrong, there's nothing wrong with that in the right hands, but I don't see the advantage of scanning abdomens if your blood tests are all normal. I don't see the advantage in a chest x-ray. I don't see the advantage of, doing ultrasound of prostate, because that's not in any guidelines at all, but they offer it. So it's really not benefiting that individual at all. So some people come in here and they put their file down in front of me when they've done it at other places. And I look through it and think, because the patients are asked themselves what package to choose. And I think that's totally unfair of how the patient's supposed to know to choose the exercise running instead of the ultrasound of the prostate. And they've chose the wrong one. And it's like, it's not their fault, but they're just not guided. So a lot of what I do is guiding. What would I do if I was you? That's the bottom line. I would just tell you. And that's the important stuff. But we've still got options to do whatever we like. That's the great thing here as well. So there's no wrong or right answer. So that's what I would say. So the next part is really the mental health approach. And now I think that's a difficult one. Very, very common here. I think this is one of the toughest countries I've worked in from a mental health perspective. I've got to be honest. I think it's, there's an artificialness about it, I suppose. It looks great. We're all working from home. We work hard. The environment factors are massive here. It's hot. I think it's very, very difficult. People don't talk about their mental health. Different cultures deal with it in different ways. It's repressed a lot. We're all different. There's no wrong or right thing to do, but I think it's very difficult here. Men as well. Obviously, we don't talk about it as much. We don't sit around having a pint of beer talking about how we feel to each other. We talk about the obvious stuff, football and all the interesting stuff. Well, other sports, whatever you like. But but it is important. And when you're working at home, got all these deadlines and people, I can't imagine what people go through here on the business spec. Very, very difficult, unbelievable amount of stress that I'm seeing, and people crying at nighttime, and they've got no energy. And so that's why it's important to know what depression is, because you may not know. You may be sitting there thinking this is normal because I'm so busy. Of course I'm going to feel like this, but not necessarily. So 1 in 8 men, do have depression, anxiety. I don't like using labels. They don't feel good. They're just not happy for whatever reason. The interesting stuff is, it's 3 times more common under 45 men than women. 3 times more common in men than women under 45. Mental health starts early. Half the people that have mental health issues start by the age of 14. 75% of people by the age of 24. what I mean by that is, if people are not happy from a mental health perspective, 75% have been medicalized by the age of 24. So people that have started feeling low is because of their environment and their workspace, and they didn't have it before. It's even more likely to be because of their environment and lifestyle now, I would say. So very important to know what the symptoms are, who to talk to, what do we do about it. Very, very, very important indeed, because most men don't. Very difficult here to go to someone and talk to someone you don't know about it as well, and who to trust and who's not just going to medicalize and not listen to you. I think that's very important in any country. Who is the best person? Who's the best psychologist? Who do we trust? Who do we talk to? You know, what the best way forwards are. That's half of what we do. You know, so I think that's important to know. So the most common symptoms here, and you could be looking at this thinking, well, I've got all of those, you know, irritability, sudden anger, increased loss of control, you know, slamming the door on your family and saying, get out, and I'm on a Zoom call, risk-taking aggression, you know, very difficult, you know, very difficult, I think, but feeling tired, poor, concentrating, you know, losing interest in things you were interested in. And also the opposite, where you don't realize some people love their work, you know, really dive into their work too much. And that is also a sign of not being happy. It's an escapist behavior. It's spending 16 hours a day doing this, and they're immersing themselves. But that's actually a sign of not wanting to integrate in the outside. So very important to know all these things. You know, so, you know, I'm not going to talk too much about this, you know, suicide. I mean, you know, but it is important that, you know, men are more likely to commit suicide than women, for sure. You know, as depressing as that sounds, I mean, very, very true. So it is important to talk and prevent this, you know. Just so, like that stat there as well, under 40, the biggest cause of death in men, well, in the UK, but it's really European and American, it is suicide. Amazing, really. So as sad as that sounds, but very important to raise the topic, you know, gender roles for men, you know, that we're socially expected to bring home the money and all those typical typecast things, which are wrong, but we can't help it, and we've got to lose that mentality, really, and just really communicate more, to be honest. That's the most important thing. So I think where I'm going with that is really making people more aware of the importance of talking, even to people like me, and what do we do about it? I mean, there's great psychologists out there. There's amazing ones. You've got to invest your health, making the workplace, you know, aware of it. You know, a lot of big companies have their HR departments, but a lot of people work from home and they don't know really. So it's making it easier to reach out, provide support. You know, we all will tell you where the best places to go, whether it's time off, counseling, medication, whatever that needs to be, exercise. But it's really important, and reducing the stigma about health, that's really important. I mean, a lot of us are proud people, and especially English people, are like, we don't really talk about it, and we think we're failing if we have to talk about it or take medication. But you can't think like that. I mean, medication, and I'm not talking about that too much, but my version of it is life's too short, and you need to feel good. So Lexapro, sertraline, Zoloft, Prozac, all that stuff, I think it's great. I mean, it makes you feel good, and it won't harm you. But, you know, realistically, though, you've got to approach the topic. That's all I'm saying, is don't not be aware and recognize signs, which are the irritability, you know, the tiredness, aggression, loss of control, the anger, you know, taking it out on family when you shouldn't do, and all important things, based on that as well, which is, this all links in together, to be honest. You know, sleep, I mean, for me, I don't think I've had one good night's sleep here since I've been here 9 years. Aircon, humidity, partner wants a different aircon setting, draining. I think it's a draining environment. Some people wouldn't agree with me, but I think it's extremely draining. And when we go back, for me personally, to European countries, we breathe some fresh air, we get loads of energy, very important. That's why sleep is so important. I mean, without a good night's sleep, I'm a wreck. I'm not 21 anymore, so I can't keep going all weekend with no sleep as I used to do when I was a surgeon. Now it's, if I don't get 2 nights sleep in a row, I mean, I'm struggling. And you guys do 10 times more stressful jobs than I do. I mean, it's very important to be alert. So it's easy for me to sit here and say all this stuff, but it's not easy. Sleep, it's not a disease. It's really, really difficult getting into the right routine. Don't sleep during the day, exercise, no social media after, well, 10 o'clock and half an hour before. It's easy for me to say this stuff, but we all on our phones constantly. As soon as we wake up on our phone, well, we have to in a way, but, you know, don't use the bedroom if you're not tired. You know, don't fall asleep in your armchair at home, and don't have a nap during the day. It's all about getting good techniques and good lifestyle and good patterns of sleep. Caffeine, you know, is not good. Melatonin, magnesium, everyone's on magnesium and melatonin. You know, magnesium seems to be the trendy thing at the moment. I've never tried it personally, but very interesting. A lot of people say it's very good. Melatonin is very good. I like melatonin. Used to be cynical, but it definitely helps. Maybe there's a placebo element, but really important, the sleep stuff. And because the worst patients I see anyway, early 50s, natural insomniacs, when they were probably mid-20s, 30s, peak of their career, successful, didn't need to sleep. But when that continues into your 50s, when we need to sleep, it becomes a big problem. So important to talk about it. You know, people take sleeping tablets, medication, and it's all good stuff. There's no stigmatization against it, but not regularly. Here and there, it's okay. Traveling, jet lag, very difficult, but you know, sleep is very important. You know, so a lot of topics there, but all linked in together. You know, prevention, sleep, depression, mood, getting your skin checked, getting your heart checks, getting your bloods done. It's a no-brainer. I mean, no, why wouldn't you do it? I don't know. You know, so you know, I get mine done, and I'd get mine done every year, and take it from there. Really, it's amazing. Some people don't like knowing. It's interesting. We're all interested. That's why it makes it an interesting job. You know, some people don't want to know, and you know, you just there's just no need. As long as you do it with someone sensible who won't over medicalize you and shows you and be honest with you, that's great. That's what you need to find. So I think, you know, that's the importance of this part here is sports injuries, because, you know, a lot of us do sports, a lot of us don't do sports. We should be doing sports. The older we get into our 40s, that's not old, by the way, we're more aware of our health, I think. We become more, it's a cliche, but it's true. I go through it myself. You've got to start feeling your body, you know, when you're getting tired, you've done your work, you put the kids to bed, you do your thing, you know, and you get tired by 9. That's not what life's all about. You know, life is short, so we've got to make ourselves feel better. And exercising is so important. I mean, it makes a huge difference mentally and how you feel, I think. But what you don't want to do is get injured. So the best thing, the great thing about Singapore as well is here, because we do it around great physios here, amazing stuff. You know, access is amazing. So no reason not to use them as well, but don't get injured in the first place. So the important thing is, so for me personally, I'm doing standard charter thing in a week and a half. Do I push myself? Do you do interval training? Do you go for your 5K under 25 minutes, under 20 minutes? You know, what do you do? I mean, I would say you got to distinguish between good pain and not good pain. So the stamina is important. Are you fatigued? Do you push your through? But you don't want to get injured, because the older we are, the tougher it is to recover. And being injured is so frustrating, unbelievable. So the most common ones, what do people see me about? Despite what's on this slide, back injuries, hamstring, knee, ankle. Yeah, that's the biggest stuff. So as you can see here, you know, knee is the ACL sprain, that's knee, cruciate ligament strains, ACL. Ankle sprains, plantar fasciitis is very, very common indeed. That's really annoying, because that's just not just from sport, that's from walking around on marble floors with nothing on. You know, wearing flip-flops all the time because it's hot, terrible shoes, awful. You know, people not getting the right footwear doing, not wearing Essex or New Balance or Hoka, or, you know, getting your feet looked at. That's very important. You've got to change your shoes every 8 months, every 800 kilometers, you know, and then people maybe think 800 kilometers, not, It's not that much if you're a runner. It's not. You've got to change your shoes every 8 months. You can't wash your shoes in the washing machine, which I do all the time. You can't do that. Running in the rain is beautiful. I love that, but it's supposed to be the worst thing for your feet. And it's true. So I talk to a lot of ankle and foot specialists here. And one of the most common causes of injury, because people are running in the rain. And so the cushioning on their shoes just is non-existent. And washing them in the washing machine, just don't do it. I've totally changed. I still run in the rain because I love it. So, but it's not good for your knees and your ankles. So change your shoes. That's a big thing here. Plantar fasciitis, very tough to do something about that. It's the undersurface of your foot that becomes inflamed and painful. You get out in the morning, put your foot on the floor, and your heel's already painful. Terrible stuff. But that's all about wrong shoes, wrong mechanical footwear, wrong running technique, being overweight, and that can be tough to deal with. So very important to approach that and tell someone. Don't I won't run for a week and it'll be all right. Nothing gets better by itself in this country. You have to talk to someone, especially here. Like, the ease of access is so easy here. You can email me, you can ring us. You don't have to make a formal thing of it, but let us know what's going on. Ankle sprains, low back pain, tennis elbow. I mean, tennis elbow is so frustrating for tennis players. That can go on for ages, but there's some great things we can do. But you can't do nothing. You know, hamstring, ACLs, you've got to see a physio. You've got to talk to us to see a physio. They don't get better by themselves. So what you don't want to do is rupture anything, because then you're 6 months off. So these are the most common things. And realistically, what I mean by all of this is being aware of your body. And when it doesn't feel good, stop. Don't do impact sports until you've spoken to someone. Because you don't want to prolong it. You want to get it treated quickly and get on top of it, really. This is the plantar fasciitis, really, just giving you a slide there, but where the plantar fascia is on the right, and really what you're straining there. It's all mechanical. It's all about, there you go, the flat feet, poor footwear, marble floors here in Singapore, trauma, just being on your feet a lot. You've got to listen to your body. Very, very common problem, that one. Ankle sprain. I'm not going to explain what ankle sprains are. It's just, again, same real risk factors, really. Overdoing it, doing too much and not doing it softly with really a program in mind. But once you sprained your ankle, it can take 3 to 6 weeks. So and then you've got to do a program where when you get back into it, the important thing is you don't just go running again. You do really the walking and the swimming and the cycling, and then build up your strength again before you go running again. So low back pain, I would say, is not just about sports. Very, very common thing here, in everywhere, I suppose, but it's how to approach it that's so important. Who do you see? Do you do an MRI? Do you see a physio? Do you take medication? It's a tough one. But it's important to really look at what's happening. Talk to a GP about it first. Which direction do you take? Do you see a physio first? Is it posture? Is it the seat you're sitting in every day? Is it your impact sport? Running and cycling, running and mountain biking is the worst thing for backs. Swimming's great. Cross trainers great. Non-impact sports are great, but running's bad. But that's why we got to get onto it. Do you do a physio? Do you take anti-inflammatory? Do you do an MRI? Because we can do whatever we like to get some information. But very important not to ignore it as well, because it can impact your whole sport and health in general. Pain that may come suddenly, pain that's dull or achy, it doesn't matter. Whatever you feel like is not right, talk to someone. Let us do our thing, and I can tell you what we think, really, some more than others. So important to verbalize. That's what I would say. So I think really over all of this, nothing groundbreaking from me, I don't think. But I think the important part of all of it really is just really to be aware of, it's more prevention. Okay. That's what the key word is. There's always keywords, but it's not screening anymore. I would call it prevention. And just, you don't want to become diabetic or having heart disease in the early 50s and thinking I should have done something about it, because you can prevent, diabetes can be prevented 30% of the time. Heart disease can prevent 40% of the time. And when we're in Singapore, got access to health and all these great tests, I think it's amazing. There's no reason why we wouldn't do it. So So that's the important stuff. You know, all of this is on websites, and I think these slides will probably be accessible, and I'm here. People can email me anytime. But I think it's good to have, you know, people come in for a good half hour, and we just talk through all of this. And I say the same thing to everyone. Most people, we tailor it according to what we find. But I think the important thing from my point of view as well, the other stuff like the vitamin D's, the iron, yeah, I think it's all all important. I would say, really. There we go. I think that's the important stuff.
Thanks so much for that, Dr. Chris. That was really, really informative, and I think you covered a lot there. So yeah, that was really, really good. I just wondered, does anyone have any questions for Dr. Chris before we wrap up? Don't think there's any in the chat. Yeah, I think you covered everything.
Yeah, it's a lot of information there.
Yeah.
Feel free for people, you know, if there's some patients that I know, you can email me anytime, by the way, and, you know, come in, have a discussion. But the bottom line is it's a no-brainer. Prevention, stress at the moment, and emotional health is really tough. I mean, it's great that we're all traveling now and getting out and breathing, but then it's not easy. Really, really difficult, you know, with the masks and everything, and really tough. So the loophole of not wearing masks is exercise, right? So no reason. Yeah, but use me, use and abuse me. That's what I'm here for. I'll ask all your questions, and I'll tell you what I think.
All right. Well, thanks so much, Dr. Chris. And we will upload the chat to our YouTube channel, and I'll also send out a summary of the talk today to you via email. So yeah, thanks so much.
Cool.
Thanks everyone for joining us this morning.
Have a good day, guys.
Thanks. Bye.